This is Lee. Lee is a project manager at a health department. Her coworker, Grace, stops by Lee's desk to chat and asks her if she's planning to complete the latest PH Wins survey. Lee's not sure. She has a lot on her plate right now. Grace tells Lee that she understands, but she's finding time to take PH Wins because it gives her the chance to provide feedback on what's working well in her agency and where there's room for improvement. PH Wins has the potential to make real change for the public health workforce. Past PH Wins surveys showed that the workforce wanted more training in budgeting, strategic thinking, and policy engagement, as well as in advancing justice, equity, diversity, and inclusion. Within a few years, quality programs have become available to meet those needs. For example, the second PH Wins survey showed that people in public health wanted to know more about business and finance skills. The BEAM certification course at the University of Miami was a direct response to that need. Similarly, the third PH Wins survey measured the impact of the COVID-19 pandemic on public health professionals' work and work lives. This data helped make the case for employee wellness programs and ways to address burnout in health departments across the country. Lee was glad to learn more about how PH Wins is used, but she is still wondering about a few things. Lee's schedule is already tight. How long will it take? The PH Wins survey should only take about 25 minutes. It's been worked out and tested by public health professionals just like Lee to ensure that taking the survey takes as little time as possible while still providing meaningful data that can help inform workforce efforts. She doesn't want to deal with any more spam. Will taking the survey mean her inbox will get flooded with follow-up emails? No, PH Wins was created and is managed by public health professionals. Lee's email address and other personal information are safe. Will anyone be able to figure out which survey was Lee's? No. PH Wins is an anonymous and confidential survey. Participant privacy is a top priority. Individual responses will not be shared with Lee's agency. How can public health departments access and use the data? Each health department gets a dashboard of the results from their workforce, which they can interact with to answer specific questions. National-level results are published online. After learning that taking the survey would be quick, her information and responses would be kept private, and that the results of PH Wins make a real difference, Lee decides to take PH Wins and let her voice be heard.